Bronchitis is a respiratory condition in which the lining of the bronchial tubes becomes inflamed, causing coughing and difficulty in breathing. Individuals with bronchitis often experience a persistent cough that can produce mucus, ranging in color from clear to yellow or green, depending on the nature of the infection. They may also encounter symptoms such as wheezing, chest tightness, and fatigue, which can interfere with daily activities and rest. Treatment usually involves rest, increased fluid intake, and medications such as bronchodilators and anti-inflammatories to manage symptoms, while severe cases may require antibiotics if a bacterial infection is suspected. Smokers, the elderly, and those with weakened immune systems or chronic respiratory conditions are at a higher risk for developing bronchitis. As we look further, here are detailed aspects of the disease to better understand its impact and management. Symptoms and progression of bronchitis. Bronchitis is a respiratory condition characterized by inflammation of the bronchial tubes, which carry air to and from the lungs. Symptoms typically start with a dry cough, which then becomes productive, yielding mucus that can be clear, white, yellowish gray, or green in color. As the disease progresses, sufferers may experience a persistent cough, fatigue, shortness of breath, slight fever and chills, and chest discomfort. Acute bronchitis often follows a cold or viral infection and usually resolves within a few weeks, while chronic bronchitis, a type of COPD, persists for months and can exacerbate, leading to significant respiratory compromise and reduced quality of life. Diagnosis of bronchitis. Diagnosing bronchitis, particularly differentiating between its acute and chronic forms, hinges on a careful evaluation of symptoms and medical history. Acute bronchitis, often following a cold or respiratory infection, presents with a cough that may produce mucus, lasting several weeks. Chronic bronchitis, a subtype of chronic obstructive pulmonary disease, COPD, is defined by a persistent cough with mucus most days for at least 3 months, 2 years in a row. Healthcare providers may listen for wheezing or abnormal lung sounds, utilize spirometry tests to assess lung function, and possibly leverage chest X-rays to rule out pneumonia and ensure accurate diagnosis and management. Early detection is paramount, as chronic bronchitis, if left untreated, can lead to significant lung damage and exacerbate complications. Cause and risk factor of bronchitis. Bronchitis arises when the bronchial tubes, which ferry air to the lungs, become inflamed and swelled, typically triggered by a viral infection. While colds and flu are frequent culprits, bacteria can also cause it. Smoking is a significant risk factor, irritating the bronchial lining and weakening respiratory defenses against infections. Additionally, exposure to pollutants, dust, and chemical fumes in the environment or workplace can heighten the risk of developing bronchitis. Individuals with weakened immune systems, the elderly, and those with heart or lung disease are especially vulnerable. Chronic bronchitis, a type of COPD, is usually the result of prolonged exposure to irritants, particularly tobacco smoke. Treatment and management of bronchitis. Effective treatment of bronchitis revolves around symptom relief and addressing the underlying infection if it's bacterial in nature, as viral forms typically resolve without antibiotics. Inhalers and medications can help ease wheezing and shortness of breath, while mucolytics may thin mucus for better clearance. In chronic cases, pulmonary rehabilitation enhances lung function through exercise and education. Smoking cessation is paramount to prevent exacerbations. Adequate hydration and humidifiers ensure moist airways, facilitating mucus clearance. For severe cases, corticosteroids or oxygen therapy may be employed. Understanding individual triggers and early intervention is crucial in managing episodes and maintaining quality of life.